Good morning, good afternoon, or good evening, where in the world you are. Welcome to the Gender and Digital Health webinar series, which is a platform to foster new partnerships and co-create knowledge on the gender dimensions of digital technologies for health, with a focus on translation of evidence to policy and practice-based learning in low and middle income countries. The sixth session of the series is about big data and AI for gender equity in health. This session will discuss the digitization of gender inequities in big data sources, technology workflows, and digital health algorithms. Next slide, please. I'm a research fellow at United Nations University, the International Institute for Global Health, and I will be moderating this session with my colleague Amnesty Lefebvre, who is associate professor at University of Cape Town. Next slide, please. So this series is organized by a consortium of the United Nations University, the University of Cape Town, and BBC Media Action. We have these monthly webinars, and all the recording of the previous sessions can be accessed on the Gender and Health Hub of the United Nations University IIGH, and also on YouTube in the sites that are indicated in the slides. And you can live tweet your thoughts or comments or reflections, but please use the hashtags GHHTalks or the hashtag Gender and Digital Health, so we can monitor the impact and the reach of our webinar. And please introduce yourself and ask questions in the chat. Next slide, please. So this series continues until the end of this year. So the next month's webinar will be on gender and phone surveys, and we are planning to have online workshops later in the year. One workshop on designing process evaluations with a gender lens for digital solutions, and one on metrics for measuring access to and use of digital tools, and we are all invited to these workshops. So the way that we run the webinar, it's in a cumulative audience logic, so you only need to register once. And when you register, you will receive the monthly updates and the main points of the discussion and recordings of the sessions and the invitations for these webinars. Next slide. So in terms of our outline for today, we will have, after this welcome and some introductory remarks by Diva Dar, we will have 3 presenters. We will have Anita Raj, who is going to discuss some examples of the use of big data to understand the gender aspects of the pandemic. Then you're going to have 2 presenters, Franz Young and Nicole Figot, who will discuss the link and the evidence gaps between the gender digital divide and inequities in healthcare. And finally, we'll have Jonathan Jackson, who will discuss the use of big data and digital health to improve women's health outcomes with a practical example of ComCare, which is the most widely deployed technology platform from frontline health workers. After the presenters, we will have 2 discussants, Neha Kumar and Mamelu Tiniane, who are going to have some reactions and some remarks related to the presentations, and maybe kicking off the Q&A with some questions to the panelists. And you are all welcome to pose questions to the presenters in the Q&A chat. And we are aiming to have a discussion-based Q&A of 30 minutes. So if you're in YouTube, feel free also to ask your questions in the chat in YouTube. And next one. So in previous sessions, we talked about the gender gaps in phone ownership and access and use, especially amongst the most marginalized populations. And we have been centering these webinars on this assumption that there's a direct path between the gender access and use of these digital technologies and gender inequities in health. So we have been unpacking these pathways where the gender digital divide will generate or amplify gender inequities in health. For example, in the first session, we had Diwakar Mohan presenting a study that shows that phone ownership is associated with adoption of some health behaviors and health outcomes related to the reproductive, maternal, neonatal, and child health. And we also discussed in previous session a indirect pathway that gender access and use will generate biased data and unfair algorithms, but this will be the main topic of the session today. So we want to understand how digital health tools that rely on biased data and algorithms will lead to inaccurate outputs for groups underrepresented in the data, and in turn will contribute to widen existing inequities in healthcare. So we had a good practice example in session 2 with Andrew Ball, explaining how the Western Cape Provincial Health Data Center used sex and age disaggregated big data to support health responses to COVID-19. And in session 3, we had Zinnia Del Pilar from Datapop Alliance explaining how big data was used in Mexico, Brazil, and Colombia to understand trends in GBV during the pandemic. So we are looking forward to the presentations today. And now I will hand over to my colleague Amnesty, who is going to introduce Diva Diyar. Thank you very much.
Thanks so much, Claudia. That was a wonderful overview, and welcome to everybody. We're thrilled to be here with you for the next 90 or so minutes. So we wanted to now shift to kind of introduce our first speaker, Diva Dar. Diva is a senior program officer within the gender equality team at the Bill and Melinda Gates Foundation. She leads work on gender data and measurement, as well as evidence generation on women's work and enterprise in East Africa and South Asia. Previously, she led research and evaluation portfolios on health, nutrition, youth, and gender in India. And some of you may be familiar with her work there. She's been a longtime supporter of, I know, many of us on this call. So we're very, very, very thrilled she's here today. Prior to joining the foundation, she also worked for many years on public policy research and design for JPAL, Innovations for Poverty Action, the World Bank, the Planning Commission for India, and a range of other nonprofit organizations. So in addition to this sort of wealth of research, not only with the foundation, but with different organizations, she somehow has managed to squeeze in a time to pursue a PhD at the University of Oxford. So we're thrilled again she's here today. Without further ado, Diva, can I hand it over to you?
Thanks, Amnesty. It's great to see so many familiar faces here today, and excited to have this discussion. As many of you know, we're actually in the midst of 3 very exciting days for gender equality, and those of you invested in gender data, with the launch of the Generation Equality Forum in Paris yesterday, where world leaders, activists, advocates, private sector foundations, a number of people are gathering in person in Paris, but also virtually from around the world to make commitments and celebrate work towards gender equality. Over the last 24 hours, we've already heard over $40 billion of commitments towards gender equality being announced. And it's been, from a data point of view, also very heartening, not only because data has been brought up again and again in the session, but it's been given a central place even in the kinds of commitments that have been announced by governments and leaders yesterday. And I think this paves the way for the sort of next generation of research and efforts, data efforts that are going to help fill gaps for gender equality. So keeping that in mind, it's been heartening. Just, I know, because for the last year, many of us have been seeing data efforts, struggling in countries within national statistical systems. Nationally, there has been a drop in the kinds of data that have been generated, just given challenges to mobility, to data collection, to production. We know that 9 out of 10 country statistical systems have received funding cuts towards gender data. And there are growing exacerbated gaps around issues of health, economic opportunity, education, and many other domains, which we knew, there were systematic gaps even before COVID has only deepened and exacerbated these. I think why it's an exciting opportunity for those of you working on big data and AI is that there's been a boost and a stimulus over the last year towards the use of non-traditional data sources for gender equality, but also just generally for understanding the world around us. It's been heartening to see how social media, some of which we're going to hear later today, news, telecom media, app-based data, geospatial data, new types and kinds of data are being used to provide more rapid insights, complementary and unique insights to help understand issues around gender, around health. And we're going to hear more about that later today. While there have been a number of advantages in terms of time horizons, the kind of frequency and cost that big data and AI provide, there are, I think, a number of issues which I hope we'll also hear more about today in the kinds of partnerships that are needed, the kinds of safeguards that are needed, the limitations that many of you are thinking through in terms of bias, sampling, representation, not only of women, but of other types of intersectionalities as well. And I hope that the discussion today, we not only hear about how these sources are being leveraged to answer important questions around gender and health, but how we can start thinking more about data collaboratives to really answer policy responses, to harness different disciplines, but to work closely with policymakers and decision makers to help them understand various gender issues better. So this is an exciting time for big data and AI, and I'm going to pause there so that we can hand over to the next rounds of speakers who will be hearing from today and whose work I've been delighted to watch over the years in terms of how social media and other sources, app data, are helping fill and understand some of these questions that we're grappling with on gender equality. Thanks.
Thanks, Diva. That's an excellent sort of overview and call to action. I'm going to particularly just follow up kind of on the points you've just raised about the importance of non-traditional sources of data. And I think a further sort of reflection and discussion of that is the perfect segue into our next series of speakers, which Claudia will now introduce. Claudia, over to you.
Thank you, Amnesty and Diva. So the next speaker is Anita Raj, which I'm delighted to introduce. Anita is a Tata Chancellor Professor of Society and Health Department of Medicine and the Director of the Center on Gender Equity and Health at UC San Diego. So Anita's research, including both epidemiological and intervention studies, focuses on sexual and reproductive health, maternal and child health, and gender inequities, including gender-based violence. She has also conducted research on gender disparities in retention and advancement in academic medicine. Anita has over 200 peer-reviewed publications, and her work has been featured in major media outlets in the US, the UK, and in India. She has served as an advisor to UNICEF, the WHO, and the Bill and Melinda Gates Foundation, and was invited to speak at the UN General Assembly on the issue of child marriage. She recently contributed to the Lancet series on gender equality and health, where she analyzed gender inequities in health systems. The floor is yours, Anita.
Thank you so much. Thank you for inviting me. I'd also like to just recognize as I go through this presentation, my doctoral student, Navamalika Dahingia. She is a fellow with our center and has been just a leader in guiding us on how to conduct these types of analyses with big data. What I'm going to talk today about is some briefs we created that focused on analysis of the gendered impacts of COVID-19 using social media data, Twitter specifically. Next slide. So as many of you know who are working in this area, it's been very difficult in many locations to be able to get data because of the pandemic and resultant shutdowns. While we are trying to be able to, there's on and off opportunities to get some of the traditional data that might be obtained through household surveys, we can be looking at big data to fill in the data gaps. Certainly we recognize some of the limitations of big data with regard to who's accessing it and how they're using it, but it does allow us to get unique insights into a wide range of issues affecting women and girls and from cross-national settings. To that end, our team led a series of briefs that involved the analysis of big data, Twitter and Google Trend data, to look at key gendered issues of how the pandemic is affecting women and girls in different country contexts. And when we did this, we had an eye towards not just conducting the analyses, but putting the code out for public availability so that people who wanted to replicate it, the analysis into other national contexts could do so. I'm going to focus today on 3 sets of Twitter analyses we did. One is on online misogyny, another on gendered educational impacts, and a final on political leaders' messaging around COVID-19 and how that differed by gender. I also want to recognize Data2X for graciously hosting the brief series and working with us to create very palatable briefs that can reach a lay audience, which is then thereby linked to the code that would allow you to run these data for other country contexts. Next slide. Okay, so I'm going to go through each of these slides and rather carefully because each will represent a different study. So again, I want to recognize Malika, Neva Malika, which she goes by the name Malika, for the wonderful work she did in doing these analyses. So what we looked at was online misogyny and the change over time in 5 South Asian nations. And so we were looking from, and you can see at the table down, or the graph down below, from November 2019 to November 2020. We analyzed the data let's see, we qualitatively analyzed the data to look at the daily volume of misogynist tweets. There were key codes in terms of trying to pick up the misogyny, and we can talk a little bit more about that, Malika, in particular in a bit to understand the coding strategy. And what we did find was, in fact, that there was a significant increase in the percent of tweets with misogynist content over the course of the pandemic. You can see that slight elevation starting at around July, which makes a lot of sense because that's when we started seeing the increases in numbers in the context of the region. A lot of the content involved gendered slur words, but some of it was directly abusive, some of it was discrediting women's reporting of various kinds of violence or criticizing feminist movements. We saw distinct peaks in the volume of misogynist tweets when there were gender rights events. So in other words, probably correlating with an increase in, let's say, International Women's Day, that there might be an increase in tweeting around these issues, you would see the increase in the discrediting. But as you can see here, that doesn't quite explain the level of increase we're seeing from July 2020 until November 2020. And what we're seeing is really just a general trend upwards in misogynist tweets. And this seems to correspond with also an increase in gender-based violence we're seeing in the same period. Next slide. So another thing that we focused on, this one was led by Arnab Day, another doctoral student with our program. And what we looked at was using topic modeling, the Twitter use around girls' education during the COVID-19 pandemic. So in this particular case, we identified 61 Twitter accounts of organizations working on education policy, but particularly related to education access across national settings. And that resulted in about 9,000 tweets. The topic modeling analysis identified 10 distinct topics, and you can see some of these topics up above. What I really want to highlight are those topics that you can, that profile some of the trends we see. So the topics that we recognized were girls' retention in schools and increased risk for girl marriage due to COVID-19 with the loss of school. Also that there was a lot of food insecurity due to the loss of education. So you can see some of the tweets were elevated around certain times. Again, you can see that with regard to date. So for example, if you look at the topic on child marriage and its impacts on education, topic 1, you can see an elevation around October 2020. So that would be corresponding with the Day of the Girl Child. Gender disparities in education attainment, also you can see the spike around then, and you can also see it around school-based violence. Yeah, no, I don't disagree with you, Arjun. We've got a report that the rise seems pretty small. So remember, these are the tweets as available from these education organizations. So usually the tweets, this is very professional context. And so what we tend to see is that they're getting used around certain times of year, but the nature of that use is really around these issues of keeping girls in school, how schools represent safety for girls, and the experiences of violence attached to girls' lives through online abuse. And then also a worry that, even in the context of schools, so there's gender-based violence. A particularly important issue that we thought was really relevant to the timing was that there was food insecurity, though. And there was also a particular recognition of vulnerabilities of low-income girls, and particularly girls living in crisis areas. Next slide. Okay, now I want to just focus, and I know that I'm going through these quickly, but we were to keep to about 7 minutes. I wanted to make sure we got through a piece of this. In all cases, there's a link to be able to read the full brief, which includes, again, methodology and more detailed information about the analyses. So here we analyze tweets from the Twitter accounts of heads of state for all available countries from the period of January 2020 to February 28th, 2021. This was 62 heads of state, 51 male, 11 female. An interesting aside is that I'm residing in the United States, and we were not able to get the tweets from the president at the time throughout much of this time because his account was taken down from Twitter. Nonetheless, we had almost 43,000 tweets. There was that about 16% of these tweets in the time period were related to COVID-19. And as you can imagine, the tweets increased over time, particularly around onset of the pandemic in the States. The tweets on COVID-19, they were analyzed on the basis of themes and sentiments. So themes was more of the content, and sentiment was more of the feeling of it. So you can see in terms of thematic content, it was a focus on COVID surveillance, prevention practices, and that could include vaccinations, the economic effects, and gender issues. And you can see that across these areas, gender issues received the least attention, with a slight but not significant difference of it being more likely to be discussed by women leaders, heads of state who are leaders. But more obviously, while we don't see a significant difference in COVID surveillance, you can see that prevention practices and vaccine was more commonly described by males, whereas as were the economic aspects of COVID. But in terms of the sentiments, what you see is that female leaders are more likely than male leaders to exhibit notions of collective efficacy or unity, or the country banding together to address the crisis. And we're also more likely to bring in terminology and phrases that denoted empathy, and sort of the consequences of things like the economic costs. So we can see a very strong difference by gender, and it corresponds, as many of you may know, these other data that show that women heads of state had earlier responses and exhibited more prevention response, and there was some indication of better, in some studies that indicate better pandemic control and management in countries led by women. And so it isn't, while the messaging itself can't tell us exactly if it's linked to the differences in response, what we can know is we do see some differences by gender in terms of the nature of the responses and the guidance that is being used to direct countries. Next slide. So what are our big conclusions from this? The first is that we see a demonstrated increase, that the demonstrated increases in violence against women that have been documented under the pandemic, including here in the United States. We've seen it in many country contexts. We've actually seen increases in crime in many country contexts as well. That these are really occurring in line with increased online misogyny. So while we have not looked at these issues, the issues of other forms of discrimination in other contexts, but in the context of the US, we have also seen increases in hate crimes that are race related, and we have also seen increased online sort of racist rhetoric. So it does seem that there's something happening around preponderance of negative responses based on social characteristics under this pandemic. With regard to educational access organizations and movements, these are groups that are recognizing the gendered vulnerabilities in access to education, and they reflect some of the broader recognition of increases in violence and controls girls may be facing, particularly in low resource and conflict affected areas. One similar finding that we found in the United States in a survey-based research, it's actually specific to California, is that where there is greater access to internet use, we actually saw a significant increase in cybersexual harassment of women during this time as well. So we're definitely seeing some issues regarding gender that schools are going to need to be prepared for. I do agree that I think that it's not quite at the level of, the tweets aren't quite at the level that we would hope to see an emphasis on these gendered issues. And it's an area that we should probably be promoting and supporting more recognition of. Next slide. Okay, so also we are seeing that gender may influence pandemic messaging and response among world leaders, with women heads of state relative to male heads of state posting slightly more proportionately, posting earlier, and posting with more sentient messaging, where men are tending to focus a bit more on issues of COVID management and the economy. So sort of the secondary impacts are gaining more attention from women heads of state. We have actually done a similar analysis with US governors. And one of the very interesting findings, we looked at it by gender and by political party, and actually gender had as much effect, if not more in some areas, as political party in explaining or being associated with differences in some of these same issues. But overall, what we are also seeing is that the gendered impacts of COVID-19, many of these social and economic, what we are calling secondary effects, that disproportionately affect women and girls, are not getting much focus from heads of state. Although when it does occur, it seems that women are more likely than male heads of state to be responding, are bringing out those messages. Next slide. So the final point we want to highlight is that big data like Twitter can offer really important immediate insights into gender issues, and they can be especially useful when ground data are not available. It took time to be able to, we were hearing from hotlines, that maybe there were more calls coming in on violence against women or violence in households, family violence, violence against children. But this is kind of like maybe potentially was the misogyny data was potentially a bit of insight into or foreshadowing of that in the absence of the actual data. And so this could be an important way to sort of start to take the pulse of where people are. Recognizing the biases that are there. The data are certainly biased by resources and access in terms of, and the nature of users. We recognize that, some of the most people who feel strongest about an issue, either in favor or opposed, are more likely to be engaging in social media with language related to these types of issues. Another concern is that the data are quite available. They do require a certain set of analytic skills, and it's not an analysis that many social science and public health researchers have at the table. And so one key issue is that I think that there needs to be readily available training rapidly to help support people across national contexts to be able to utilize it, and that we all should be starting to share our code more regularly to allow people to be able to easily apply algorithms to understand issues in diverse country contexts. Next slide. And this is our team. I want to thank everybody. I would like to thank Bill and Melinda Gates Foundation, including our program officer, Diva Dar. And again, thanks to the leads on the three papers, Malika and Arnab, for their incredibly important work. All right, thank you so much.
Thank you very much, Anita, for presenting these fascinating studies. And I really appreciate all the work that goes into just filtering the Twitter data based on keywords and hashtags. And thanks also for your rich reflections and for making the methods and code available for other researchers to replicate them in replicated studies in other contexts or times. So we have one question for you in the chat. Maybe we can ask you now, and we can save other questions for the Q&A, but let me extend a welcome for those of you who just joined. So please feel free to write your questions in the chat. So we will pick them up if they are timely, or we can just wait for the Q&A in the end. So we have two questions for you. The first is that you mentioned potential issues around responses biases, indicating that those who are particularly impassionate are responding. And what other biases have you encountered when analyzing this data? And the other question is that in absolute terms, the rise seems pretty small. Is this a result of the overall volume of tweets in the sample? Would the trends be stronger in more localized contexts? And have you seen similar small absolute findings in the past? The participant was wondering if zooming into a context helps. So yeah, feel free to respond to these questions, or if you prefer to leave them later, it's also okay.
Yes, thank you. I will. I'll ask Malika to be able. She'll be able to. I'm going to start with the one on other biases, and I'll turn to Malika, because she probably in analyzing the data probably has a better pulse on that. Malika?
Yeah, thank you for the questions. So regarding the first question about biases, one of the main biases when working with social media data is definitely the fact that it is usually used by individuals who are more educated and perhaps more likely to be living in urban spaces. So that's one of the limitations that I believe we have to acknowledge and live with while running these analyses. Some of the other inherent more gender biases that could creep out from these analyses, we try to mitigate by basing most of our work on prior theoretical work. For example, our work on online misogyny, it relied heavily on prior work that has been done to understand, real world or offline misogyny. And also for all of our briefs, we incorporated qualitative examination of subsample of tweets as one of the methodological components in order to check the reliability and validity of our findings from these machine learning models, and to assess any sort of inherent biases in the models as well as in the findings. So, yeah. Regarding the second question, which was about the absolute terms in the rise that seems small, yeah, we do agree that in absolute terms, the rise in online misogyny does seem pretty small, but we looked at other similar studies from the US, and our estimates were in line with their findings. And this could be because we've had used almost a population level sample. So our analysis included all of the geotagged tweets posted from these 5 countries before and during the pandemic. So overall, around 19 million tweets were included in our analysis. So just to put these seemingly small estimates into context, I'll cite another study that was carried out by Amnesty International with female Indian politicians, where they found that every woman was receiving on an average around 100 abusive tweets daily. So overall, even though the number is small, it's just that the volume of tweets is just so large that the estimates seem small. But the impact definitely is much higher than we know. Yeah, thank you.
Thank you, Malika, for these really great clarifications. So we will have more time for discussion at the hand. Let's now hand over to Franz and Nicole. So I'm delighted to introduce Franz Young, who is a senior gender integration specialist at the Stanford Global Center for Gender Equality. Franz first started working in gender issues in 1991 and has been a gender specialist for over 20 years with work experience in East and South Asia, East and Southern of Africa, and the Middle East. He has demonstrated experience in designing and implementing gender research and in providing gender and rights policy and technical advice, as well as capacity building support in a variety of social and economic development areas, including education, sustainable livelihoods, small and micro enterprise development, gender and rights, child rights, and gender-based violence. Franz specializes in gender mainstreaming policy and practice, including organizational assessments such as gender audits and strategy development for research centers, multilateral and bilateral development agencies, and NGOs. And Franz is going to present with Nicole Figot-Cutty. Nicole is currently a gender integration consultant for Stanford's Global Center for Gender Equality, focused on providing technical assistance for gender integration to development organizations. Nicole has worked at the intersection of public policy and social development for organizations including UNDP, UN Women, Foundation IDEA, the Hunger Project, Equilu, and USAID. She is part of the founding and leadership team of the Society for Gender Professionals and holds a master's degree in public administration with a focus on gender policy from Columbia University. Thank you very much, Nicole and Franz. The floor is yours.
Thank you so much, Claudia, and thank you for inviting us to participate in this panel today. So my colleague Franz and I will talk about why big data for health and how the digitization of health systems and services are not inherently a good thing for everyone. We know that digitization and health equity has been a recurring theme in this series. And what we hope to do today, based on our experience working in digital health services, as well as financial services, is to share our understanding of where inequities in digital health can come from, the effects that they have on healthcare, some of the things we know can help to solve it, and the things we still don't know about gender and digital health beyond access and connectivity. We will also draw on our extensive experience with gender mainstreaming, particularly gender and organizations and gender transformative approaches, basically providing more insight into the pathways that Claudia mentioned in the introduction. There may be a certain impression, which the tech industry helps to spread, that big data and digitization are the future and how we will solve and improve practically all of our aspects of our world. And certainly digital health aims to improve health outcomes, and it has done so in many ways through things like data-based treatment decisions, which if done well can really revolutionize the field. But what happens when the digitization is not as well done as we think? For example, when the data, that those data-based treatment decisions is biased. The data that they're based on is biased. So the pandemic is further accelerating the pace of digital transformation, and thus it's more vital than ever that we make sure this transformation is done right. It is also a time to reflect on what it is that we are transforming through digitization. Are we transforming people into data sources, or do we want to really target the roots of inequity within health and tech systems to truly transform the way health systems can work for all? If we do not consider, or at least acknowledge, how both the health and tech systems are gendered, then digital health and the use of big health data may even make things worse for some people by inadvertently replicating or even exacerbating existing inequalities and restrictive gender norms. Next.
Great, thank you. Next slide, please. We'd like to share a framework that we've been working on, which is really to help us understand how digital health initiatives or systems can reproduce inequities. So we'd like to share this preliminary framework to understand this. Next slide. Well, first, we know that there is a digital divide, and it's the subject of previous webinars in the series. And this refers to the gap between obviously the number of men and women who access technology. And we also include it's the gap of the participation within the sector. We know that the digital divide in low resource countries provides challenges to access healthcare information and essential services, in part because women are far less likely than men to have or control a smartphone or mobile phone or other technologies. For example, there was a GSMA survey that came up just this week that found that smartphone ownership among men in 2020 went up by 4 points from 42 to 46%, 5 points from 42 to 47% compared to 2019, where ownership amongst women stagnated at 32% for the same period. And we know that actually beyond just who has access men can sometimes dominate digital health programs, even if they're meant for women. Additionally, as we know, fewer women, especially women from marginalized groups such as LGBT+ or those with disabilities, are involved in design, implementation, and regulation technology less than men. So we'll go to the next click, please. Sorry. We know there are gender biases in medicine and the health sector, which is really well documented. Don't want to review that here. Where really men are still by default the so-called neutral subject in medical research. And this has led to the development of diagnostics and treatments that don't benefit men in the same way they do women as the same as men, and have proven even harmful. You can take, for example, the well-known case of the dosing regimens for Dolpidem, or also known as Ambien, a sedative, which they found later affected women because of the averaging of doses based on men. Researcher Caroline Criado Perez and others has really shown how this leads to less knowledge about how diseases and treatments affect people differently, especially women, based on their sex and gender. Basically, it's a lack of sex and gender analysis. And Eleanor Cleghorn, an author of Unwell Women, terms this the legacy of disenfranchisement and discrimination within the health sector. Next slide. We'd like to now bring in other dimensions about gender inequity and the reproduction thereof. And one is really about organizations and leadership and how they're gendered as well. Gendered norms and power dynamics in health and the ICT organizations are part of the reason for existing inequality in women's participation in the ICT and health fields, or at the nexus of these two. These gender norms also impact how organizations are internally organized, as well as the determination of priorities and focus. Literature on gender in organizations has consistently demonstrated how formal structures can be biased as well as informal ones, and how these reproduce privilege as well as disenfranchisement, whether through leadership and or through so-called organization culture. And the other gendered nature of these organizations is the well-known underrepresentation of women in leadership, decision-making positions within the IT and health sectors, and we also know with the preponderance of women in the front lines of health sectors. So last slide, the last click. So we want to talk about technology and algorithm bias, which Nicole will cover next. But this is part of the overall framework. And the next slide, whoops, we can really see how these 4 dimensions are interrelated. And next click, where we want to basically make the argument that A, system within and with which we are working when digitizing health are gendered. B, without attention to the genderness and gender bias gets reproduced. And C, we don't really know what happens when these processes of gender bias and reproduction interact. We had an example prepared, but maybe we'll just move on and we can come back to if people are interested. So Nicole?
Thanks, Franz. When gender awareness is not prioritized in a digital strategy, the diversity of women's needs or preferences may be overlooked in favor of the male perspective, which is assumed to be the neutral one. Analysis of big data, such as electronic patient records, can power predictive models and algorithms with the aim of more accurately predicting health conditions, for example, potentially enabling earlier intervention or identifying treatments that are more likely to be effective for a certain patient. However, not only the algorithm design, but also the quality of the original data will determine how well this works. As Franz explained earlier, medicine has prioritized men's bodies and men's needs, which may lead to differences in health outcomes regardless of digitization. So, for example, very recent studies found that health risk from high blood pressure is actually at a lower range for women than for men. But until now, the same range has been used for everyone to calculate risk. So imagine building this bias into an algorithm that predicts risk using health blood pressure. This will only perpetuate the misidentification of women's risk and thus their likelihood of having negative health outcomes. And coming from a computer, these results may be less likely to be second guessed by a patient or even by a doctor. There are other ways also in which the technical architecture used in digital health systems, although made up of seemingly neutral technical choices, by replicating existing biases can impact patients' experiences and ultimately their care. For instance, the lack of sex and gender delineation in electronic health records, meaning the sex choice that doctors use in intake forms, for example, it can preserve inequities experienced by transgender and gender non-binary populations. If a system is not even considering the existence of people outside of the gender binary, then how will any differences in health that arise from these differences will even be identified, let alone addressed? This is why we need to think critically about what data, when we talk about big data, what data we are feeding into systems and how these are being designed. There are a few things that we know works to improve this, and Franz will talk about these. Next.
Thank you. Thanks, Nicole. Yeah, basically, we recognize designing with the gender lessons, and that's really means collecting sex disaggregated data, really doing that and allowing this to inform our data-based diagnostics and treatment decisions that adequately consider relevant sex differences and enable testing and validating of AI solutions. We can use this data to conduct gender analysis in initial stages of designing a project or system to understand people's different problems, needs, and opportunities based on their gender and how they interact with each other. What's interesting about this is we know this in a lot of the procedures right now for sex gender analysis, for example, for preclinical trials or for experiments with non-human subjects. Somehow though, even though we have this knowledge for now 30, 40 years, it is still not best practice within the medical field. So when we're dealing with existing technology, such as we could be conducting audits, both of its use and effects, but also looking at the source data and the codes. We can consider the different privacy needs of patients to ensure that data is protected and kept confidential. This is especially important in context where cybersecurity challenges are more prevalent and where data leaks of sensitive information could have grave consequences. Or in contexts where women already do not have control over their health-related decisions for themselves and other family members because of their gender, whereas digitization of data could actually give them less control. We can increase participation of women, particularly from underrepresented groups at all levels and stages of digital health, from ideation to testing, from design to testing. Next slide. So what we really were hypothesizing through this is that while the emphasis really has been into the digital divide on connectivity as a lead to inequity, we're making the argument that there are other dimensions to this inequity and what we don't know. And this is really about the main question for us is how do these gendered systems of health and technology interact to produce and reproduce gender inequities? And how can they actually interact in a way that can be gender transformative? Many nations don't have comprehensive digital genders, let alone gender equality genders, or even how these two integrate. Even when countries have national policies, we know implementation is sometimes wanting. This vacuum for us is of concern, especially in the pandemic has accelerated digitization across all the sectors. So we really need to know more about data knowledge to inform these policies. And understanding how gender dimensions of health systems reproduce their genderedness when digitized, itself a gendered process, is needed. Also, we need to understand how this is manifested as new forms of privilege and inequity in leadership and governance, organizations, and technologies. So leave it at that as our main ideas that we're trying for us to consider as a data, as a gender knowledge gap, and really these interactions of these processes. Thank you.
Thank you very much, Nicole and Franz, for this excellent presentation and for help us understand what we know and what we don't know about the digitization of health systems and the links with the gender inequities in health. And I really like the fact that you also brought the issue of the gender representation in the tech industry. I think that's important to keep that in mind when we are talking about these biases. And we don't have any question for you at the moment, but we hope to have in the Q&A later. So we will proceed to the next presenter. So Amnesty.
Thanks, Claudia, and as well to Franz and Nicole for really just that stimulating presentation. Our next speaker is Jonathan Jackson, and it's my privilege to introduce him today. He's the co-founder and chief executive officer of Dimagi, which for those of you that maybe have been living in a cave, you might not have heard of it, but it's a social enterprise organization that has really done amazing work to bring technology to the front lines of health services delivery in some of the highest disease burden areas of the world. As the CEO of Dimagi, Jonathan oversees a team of more than 200 global employees who are supporting digital solutions in over 80 countries worldwide. He's led Dimagi to become a leading scaling social enterprise organization, and he's the creator. It includes the creation of ComCare, which is the world's most powerful and widely used data collection platform. He's going to speak to us today about the use of big data and digital health to improve women's health outcomes. And he's going to use ComCare as a practical example. Jonathan, thank you again for being here today, and over to you.
Thank you very much, Amnesty, and to all the prior speakers. Very excited to share some of our perspective and results within using digital health and big data and AI for gender equity. I think I want to start by quickly giving a background on the organization on the next slide. As Amnesty mentioned, we are an impact-driven social enterprise supporting frontline workers, and we've been doing this for the last 20 years. So prior to the creation of mHealth and digital health and big data and AI, we've been trying to use technology in high-burden disease countries, and that basically means working with women in terms of the workforce and the community healthcare workers that we've supported. Our solution to this has been to develop the global good ComCare, which, as Amnesty mentioned, is now the most widely deployed technology for frontline health workers. So if we go on to the next slide, what our view is really around health service delivery is that all health service delivery is fundamentally a gender issue. And we've seen this in the nearly 20 years we've worked at the front lines of healthcare. And it's primarily a gender issue because our users and patients are primarily women. And I want to talk about how digital can amplify the outcomes and impacts and work of community healthcare workers and patients, but also the implications of thinking about this from a holistic gender lens. So if we first focus on the community healthcare workers, we can go on to the next slide. This is primarily a women-driven workforce. Worldwide, across all health cadres, 70% of the healthcare workforce are women, and WHO and a few organizations have just released reports on this. Within community healthcare workers, so then with some of the most challenging professional jobs at the last mile, that percentage is even higher. In many countries, it's 100%. All community healthcare workers are women. Yet they only comprise 25% of senior roles. So as we talk about how to apply things like big data, artificial intelligence, and new technologies, the workforce most impacted is all women, and the people making the decisions are primarily men. And this power imbalance is very, very challenging to make smart decisions. What we see is often more and more job responsibilities, more and more tasks shifting to an already overburdened workforce that's underpaid. And this is something that we think needs to change in the industry in order to unlock the potential of big data and AI. the people who are going to be having task-driven roles or adaptive and resilience responses based on big data or analyzing social media data or other, can't be volunteer positions who are making a best effort to provide care for their communities. These need to be well-paid, well-trained workforces that can really leverage technology and insights driven from big data and AI. And if we go to the next slide, we've seen the potential of what technology can do in the hands of this predominantly female workforce. Just some of the statistics we've done on our platform, and these would also apply to other digital health solutions. We see improvements in credibility, 30% more likely to report self-confidence among community healthcare workers who use Comcare. When you combine that with the level of attrition we often see in frontline healthcare workforces, this is a critical solution to how to bridge the gender gap in equitable access to care. The second thing we think we prioritize doing is making sure we bring a female voice and gender sensitive input at the core of the solution design. We have a methodology we call Design Under the Mango Tree that we started over 15 years ago. This is now commonly referred to as user-centered design, but it's really putting the user of the technology at the center of the design. And as I mentioned, the user in these cases are almost all women. Finally, by equipping female frontline workers, we're helping to bridge the digital gender divide. Almost all of our frontline workers are given smartphones, and therefore that in and of itself is helping overcome the 7% gap in access to smartphones. We go to the next slide. This gender issue is not just related to the community healthcare workers, but also the patients. In our work at the front lines, the vast majority of care is around maternal and child health, early childhood development, and other areas that are primarily women's health issues. So if we go on to the next slide, what we see in our work is that there's two ways in which using big data, AI, and technology can really empower and equip better outcomes for clients. One is that these result in highly effective job aids. Whether that community healthcare worker is helping during a pregnancy, during delivery, during postnatal care, using big data and AI to support where these services are given, provided, and how they're provided, turns that community healthcare worker into a more effective healthcare provider to their clients. And secondly, it provides timely and quality treatment to the households that they're supporting. Big data can play a huge role in understanding and predicting who's at higher risk for poor pregnancy outcomes, who's at higher risk for poor postnatal or under 5 outcomes, and then these resources can be redirected to the clients who need them most. And as we all know, there's a massive healthcare worker shortage of nurses, doctors, and community healthcare workers all across high burden of disease countries. And this is something that we think technology can help, because we have to optimize how these resources are reaching the most important clients. We go on to the next slide. And we think that improving community health delivery for women results ultimately in better outcomes for women. Equipping healthcare workers with highly effective job aids helps them be more efficient. A study in India found that the percentage of women ever visited by a frontline worker increased by 15% when they were equipped with Comcare. And again, I would expect this result to hold across other digital health platforms. You can imagine you could drive that number much higher using GIS data or other to infer where that community healthcare worker should target for clients who have not been served. We've also seen huge demonstrated impact on female health outcomes and behaviors, including antenatal care, delivery, and reproductive health. One of the studies we did with Diva and her team in India was showing things like a 73% increase in likelihood of attending 3 or more ANC visits in Bihar, India. So massive outcomes by equipping and supporting these frontline workers to reach clients who needed the healthcare delivery. And we've seen similar positive outcomes on child health. Now, while children are typically split 50-50 male-female across the globe, the people who are the caretakers are primarily women. And so again, child health is fundamentally a gender health issue, because allotting enough time, support, and care to the caretakers is critical for the outcomes of children. So if we go on to the next slide, really what we think is a huge, huge potential for big data and AI to optimize these frontline workforces. For the last 10 years, there's been a huge amount of work attempting to get these primary digital health solutions, often called community health information systems, to scale. We're starting to see large commitments by governments, by donors and partners to get fully equipped community healthcare workforces with the digital tools and job aids they need. The next step is going to be using all of the data they're generating to optimize who they care for, when they care for them, and how they care for them. But optimizing, again, is a fundamentally gendered effect, and we just heard the prior speakers talk about this. Just as a hypothetical example, one of the things, in fact, that Demongi itself advocates for is leveraging community health workforces to shift towards COVID response. Well, if you shift a workforce that was primarily doing maternal and child health and routine care for maternal and child health into pandemic response, that is effectively going to take a workforce that was primarily supporting women into a workforce that is supporting both women and men. That may be the right decision, but that may also result in worse care for maternal and child health vertical. So from our perspective, access, quality, and outcomes all need to be reported with a gender disaggregation. And this allows us to get the insights as we shift and optimize using more and more data where and how we want to apply these limited resources across service delivery and design of systems. And just like we pre-publish research protocols, we should ideally get into the habit of declaring what change we're hoping to affect, both the positive and negative consequences of these programmatic shifts, and then prove whether or not we did achieve those. Right now, there's a lot of lack of data, as we've heard from prior speakers. And when we say something like we should shift community healthcare workers from maternal health to COVID vaccines, we're not measuring the downside of that programmatic shift. And this is something that I think is going to be critical for the community as we try to leverage big data and AI with these increasingly large amounts of primary data that are being generated at the front lines. Last slide coming up next. So I think, we have a lot of opportunity, but huge, still long way to go. Given the global healthcare worker shortage and funding gaps, optimizing healthcare workers with big data and AI is absolutely critical. We need to make the resources we have go further and go faster. But a lot of this falls to frontline healthcare workers, and a lot of those frontline healthcare workers are community-based health workers. This workforce is predominantly working long hours and they're overworked already, so adding more work to their plate is not necessarily going to do anyone any good. They receive little recognition, and they oftentimes have little or late pay. We must fix these things in order to be able to leverage adaptive outcomes from big data or AI and predictive algorithms that can better route these community healthcare workers. And gender plays an inherent part of all of this. If we want to be able to use big data and AI to build adaptive and resilient systems, we can only do that with a well-supported, primarily female workforce. Thanks.
Thank you, Jonathan. That's a really interesting presentation. Thank you so much. While we're I'll ask Claudia to chime in with questions from the chat. But in the meantime, you spoke quite a lot about the importance of putting the user at the center of the design, and also the potential for GPS tracking to be used differentially to target and provide services to those most at risk. I wondered if you could also reflect on the challenges you faced in assuaging concerns frontline health workers might have about their privacy and the potential punitive use of data.
This is a huge issue, and I think the global health community writ large should recognize, due to the fact that we have not supported this workforce well, many of these ideas are not welcome. They feel very, overwatching connotation, and I think that's a very valid concern. Some really concerning data just came out of India around ASHAs who had felt kind of personally unsafe in their work throughout COVID, and having somebody track everywhere you're going is not a very comforting idea if you already feel unsafe in your current job. So I think these are really critical issues, and the safety and privacy and security of the workforce, safety, privacy, and security of the client and their data are paramount issues, or we're going to have massive data breaches or use of data by the corporate sector, governments that are inappropriate, and we're really going to undermine the ability to use these to bridge the gap on gender inequity or health inequity within the ecosystem. We try very much to put the client at the center of the data, in addition to putting the user at the center of the app, not always successfully. But I absolutely think the future of how we approach digital health has to be making this data first and fundamentally belonging to the patient, and then shared at their consent with the organization providing services for them or with the government who needs the administrative records. If we don't do that, not only does it lock up data and make it not portable, so clients can't get better services, you have huge data integration and interoperability issues, but it's just the fundamentally right thing to do from a human perspective, is to make sure that we're doing that. And I think workers have every right to be very concerned about how this data would be used and whether it's going to be punitive. And I think even some well-intentioned supervision programs accidentally end up being punitive in nature, and then further exacerbating inequity rather than being supportive and raising up the workforce.
No, that's very great. Thanks. Just, I'm going to follow up with one other question, then I see Franz has a comment to the one I just had. So we kind of started the session today. I think Anita gave a very nice plea for needing, code to be made open source and needing a sort of a greater, almost global community of practice around the use of AI. And I know CompCare is, unique in the sense that it has not only been scaled in such a wide variety of countries, but it's being sort of used really at the coalface of service delivery to capture large volumes of data. And I wonder if you could speak to the challenges you face around building capacity locally in data analysis and use. And then with that, the challenges you face in almost sort of being I don't want to say a protector, but something along those lines of ensuring sort of standards around data access and use controls are sort of adhered to, often in settings where there aren't the sort of regulatory bodies to oversee that. Over to you.
That's a great question, Amnesty, and I could talk about that for hours and have in some of the other forms of advocacy work that we do. But this is critical for several reasons. One, as we just mentioned, it's a fundamental just ethical requirement that if you're going to collect data from people that is sensitive, that you, as the person who collected it, are being a good custodian of that data. So I think first and foremost, nobody should be deploying systems either for research or service delivery from a technology or programmatic standpoint that can't secure that data on behalf of the people you're collecting it about. These are vulnerable populations. The concept of consent in all economies right now is kind of very hard to wrap your head around. And we owe it to the people that we are trying to support to do a good job on this. So that's one. I'd say if you can't meet that table stakes, you shouldn't be deploying systems. There's lots of ways to achieve that, but I think the industry often falls short. The second, around what you said of local capacity for data analysis and how data ownership rights flow. This is critical for two reasons. One, because if you don't get this right, then you kind of block all future use of the data. If it's not spelled up front, how do researchers get access to this? How does the government control access to this? Who really owns it? What are the rules and regulations around use of this data? This is critical and very immature in our industry, and I'd say worldwide right now too, not just within global health. If BMGF is funding Dimagi to work on a project in a particular country, does Dimagi or BMGF have rights to that data? Does the local research university, does the government, does the individual, does the community? These are complex questions, and the answer is probably varying in every single project. So we need frameworks for better data governance to unlock the potential for data and AI. But the other critical problem is if you don't unlock use of this data, you're undermining the ROI of the project. And so we come in with saying, hey, we digitize the workforce, you're going to have this adaptive resilience workforce. Then we don't do the hard work of figuring out the governance, and then we don't do the really important work of using this data set on a repeated basis. Well, then we just undermine the entire ROI of the project in the first place.
Yeah, true. And I have many more follow-up questions, but I'm just looking at the time, and I know we have our discussants to get to. Franz, please bear with me. We'll come back and circle to your other point in the larger Q&A. Claudia, can I just have you introduce our discussants? And thank you, Jonathan, for that excellent presentation. Over to you, Claudia.
Thank you, Amnesty and Jonathan. So let's continue the discussion with our first discussant, with Neha Kumar. So Neha is an associate professor in the Samnan School of International Affairs and the School of Interactive Computing at the Georgia Institute of Technology. Neha's research lies at the intersection of human-centered computing and global development. She was trained in computer science, design, and ethnography at UC Berkeley and Stanford University. She leads the Technology and Design for Empowerment Lab at Georgia Tech. So over to you, Neha.
Hi, thank you so much, Claudia, and thank you to all of the speakers for really compelling presentations. I know that we have limited time, so let me jump into kind of a quick summary and then just ask some questions. So we saw in the first presentation, looking at a Twitter-focused analysis of various kind of biases that have been showing up, which we then discussed in the second presentation, looking at various factors that are kind of intertwined. And then in the third, we looked a little more deeply at the mechanics of actually offering this type of care on the front lines. And my work has actually been looking at various aspects of this. I just wanted to quickly mention where I'm coming from, just my positionality. So I do research using qualitative and design methods, and work with an amazing group of students, one of whom, Azra Ismail, is leading work in this space, and looking at AI in global health and what the view from the front lines is. And that's a recent paper that we published in this space. And so we've been looking at data and the mechanics of where it comes from, where it doesn't come from. So looking at both use and non-use when we think about kind of the user, so to speak. And then also, all of our work actually has been in India, so looking at rural and urban India, and the work of Asha is here. And I say here because I am actually in India right now. I'm in Delhi. And then also looking at how we can think about design and digitizing technologies. So coming from that perspective, I wanted to first ask Anita, if you could talk a little bit about we heard from Deva's presentation at the start about data collaboratives. And so thinking about non-traditional data streams, right? And then you talked a little bit about Twitter, Twitter data, and certainly there are challenges around that. And I was wondering if you could reflect on just what the potential is for some of these non-traditional data streams, if you've considered them, like how might you think about data if you had access to some of these, and maybe just some reflections on what is kind of, what is missing? What are the data gaps that you've found in looking at the Twitter data that you've used?
Sure. I mean, I definitely would love to also have Malika chime in on this, but to me, at least, I think one of the hardest parts, and again, we have a team led by Monica that helps actually Malika to just do the coding and pick out the terms. But to me, I think one of the most difficult things is sometimes the terminology, it can really vary from place to place. I remember there was one term, it wasn't in this, it was in something else we did, which was a THOT. Do you guys know what that is? THOT? Well, that is a derogatory term. And so a lot of times language moves faster than, as I advance in career and in age, the language is advancing in a different direction without me. And so I think that sometimes there's a lot of contextual nuance in things as they develop, or generational differences that can be really hard to capture. With regard to with other aspects of what's missing, I think the biggest issue that's missing is the voices of people who don't have access, aren't going to be comfortable communicating through digital technologies. I think it's a really biased group that we get. But I do think that at the same time, for a lot of the work that we're doing, which is around things like misogyny, and I should mention that Malika has been, speaking of diversifying the people that are actually creating the algorithms, et cetera. She was trained as an engineer and then came to our field, and this is the nature of the dissertation work she's doing. And that's going to help a lot. But I think also, so younger people doing this, but at the same time, I think there's a lot of young males who are engaging in a lot of these online harassment efforts, online misogyny. And so I think it would behoove us in some ways to have more males who can help us engage in the coding, to actually be participating in helping identify some of the themes that we might otherwise be missing, especially when they're at the forefront of language changes or shifts in some of the thinking. And Oliver, I know that may not be the technological pieces you might have been thinking of. So I'll hand off to Malika, maybe to add.
Yeah, thanks, Anita. But I think Anita's covered the most important point, which is the lack of representation when it comes to using social media data. And I think it's a bigger problem when we try to link it with traditional data sources like survey data sources to get more nuanced aspects related to gender. But we are trying, in our current work, we are trying to sort of mitigate the effects of this lack of representation by using certain statistical methods. But still, that's a limitation that we do acknowledge. Yeah.
Thank you. And so let me pick up on how you mentioned bias, right? And then maybe pose this question to our second set of speakers. So you mentioned on your last slide, I think, that we need to think about approaches that are able to eliminate this bias. And I was wondering if you could reflect a little bit on what approaches you have thought about. I was excited to know that you mentioned the work of Perez and Invisible Women and talking about just how pervasive these biases are. Is it really possible to eliminate this bias, or if it's not possible, then what are some other things we could do to kind of wrap our heads around this?
Thanks for the question. Maybe I'll start off and Nicole can jump in. No, you're absolutely right. And I hope we didn't put the word eliminate, because I guess, well, we come from a social science background and recognize that without getting into a whole series of unconscious bias, that we have biases, we're humans. So what do we need to do? We need to be, first of all, aware of those and to be open to that and allow for processes such as inclusive processes, and that's where you certainly want diversity in workforces to really bring in these different perspectives so that our own biases, whether they're conscious or unconscious or not always negative or innocuous, can be called out. And I think we want to allow for scrutiny in how we develop our technology and the assumptions we made. And that calls for a different way of working. And I have to say that's probably one of our biggest challenges in working with, let's say, the industry. And certainly where, if we see the trajectory of professionalization of those working now within digitization of finances and health, they do come from a tech background, and that has its own, as we know, way of working, its own ethos, its own quote unquote culture. And I think that's where we get into this issue, very interesting and something that we're quite interested in from the mainstream, sort of about organizations, and thinking about organizations that are at the front of this innovation and their own thinking, and where do they get their knowledge from, and what do they count as knowledge? And this is again this idea about thinking about diversities of knowledge and knowledge making, and it's only through that process that we can be aware of our knowledge biases, our preferences that come out in this work. The one caveat is that it's hard work, just like working with white privilege. You need to do the work, and I must say, it's not a great sell. If you're going to organizations saying, if we really want to be universal, we really want to be thinking about this, we need to do the work. It's a hard sell, but I think organizations that are dedicated to it will do that, and I hope that others will be inspired to. We can't, and one last thing, we can't dismantle systemic discrimination and other forms of subordination overnight. It's really for those of us here, those of us who are in positions of privilege and power, to recognize that and to take that on and to allow for those other voices. Sorry, went on and on. Nicole, you want to add?
Yes, just to add on to that quickly. Another thing that can be done once a system is designed and operating before, in addition to everything that Frances said, is conducting audits of your algorithms. That is a very important thing that can be done to really assess how your systems are working, and if there are any biases baked in, to identify them and do your best to eliminate them. It is also hard work, especially once a system is operating, going back and auditing, maybe making major changes, but that is a very important thing to do. And also thinking critically about the data that you're using. and not assuming that because it's data, then it's fact and fair, right? Like where is, like you mentioned with Criado Perez is Invisible Women, and she talks about what data gaps are there. So going back to like really the origin of your data and auditing algorithms, those are two very important things that can be done to improve the situation.
Thank you. Thank you for your very exciting work. I'm going to hand it over to Claudia, who tells me that we're running a little bit short on time, so I cannot ask Jonathan my question. I will put it in the chat, but I'm going to let Claudia then introduce Mamelo.
Thank you very much, Neha. And I think on this note, on the data fairness and data justice, I'm delighted to introduce Mamelo Tiniani. Mamelo is a principal research fellow at United Nations University, the Institute in Macau. So Mamelo leads research on the Smart Citizen Cyber Resilience Project. This project is undertaking research and developing tools to enhance the resilience of citizens and civil society stakeholders against adverse cyber incidents in the smart digital futures. He also leads research on data and sustainable development, which critically investigates the sustainable development data assemblages and develops artifacts to support the active participation of civil society stakeholders in these data ecosystems. So over to you, Mamelo.
Thank you very much, Claudia. And thank you very much for the excellent set of presentations. Really enjoyed that. So what I want to do is really just take a quick reflection on some of the key points that were raised in the presentations. And I think for the sake of time, what I'll do is just ask the questions across the different presentations, and we can address them all at the end. So I think to start with Anita's presentations, really excellent indication of how, of course, technology and data can be used to fill some of these gaps that we have with traditional data systems and data processes. And I think this is the promise of the data revolution for sustainable development. I think a lot of us have sold onto this potential of big data, AI, to assist in filling some of these gaps that exist in our data systems. But I think at the same time, something that's glaringly obvious, especially with example of Twitter, is some of the limitations that these data sources have and these data approaches have. And so it was highlighted already by Anita, the fact that, already if you look at big data, issues such as selection bias, where you have a whole bunch of population groups that don't have access to Twitter, don't have access to internet in the first place, who cannot afford internet access. I mean, these are population groups that immediately get excluded from participating in these processes. So if you roll back to the question at the beginning, to what extent can these tools and approaches advance gender equity? I think really what we need to recognize is the fact that this is what's called the amplification theory of technology, the fact that technology amplifies institutional capacity and institutional forces that are already in place. And I think we can see this very clearly where societies and contexts where there's already institutional capacity, where there's already systems in place towards advancing some of these health objectives. We see technology playing a critical role there. But in cases where we still have underlying challenges, either structural challenges or institutional challenges, of course, similarly, technology tends to amplify the inequalities. So I really like that perspective that technology remains this lever that can either amplify inequalities or amplify the positive impacts that are already being put in place in different contexts. And I think so it remains important that when we think about what's the potential of AI and big data to advance gender equity, well, you can have both. And I think we've seen examples of where it both exacerbates inequalities and bias and marginalization, but in different contexts, similarly also advances gender equity, as some of the examples that we're given in the presentations. So I think one of the questions that I would really like to pose here is the fact that we need to be thinking about how do we integrate some of these advanced big data AI algorithms with the traditional data sources and the traditional approaches. So I like the fact that you mentioned the use of qualitative data approaches. So how do we hold those two in tension? How do we use some of these integrative and intersectional data approaches to help us understand and advance gender equity in a more systemic way. So that's a question that I'd love to hear from the presenters. What do they think? How do we hold this together? The presentation from Franz and Nicole was really great presentation. And I think for me, one of the key things that was really highlighted there is this idea that we can no longer assume data to be neutral. We can never assume algorithms to be objective. There's no such thing as raw data. Data is always baked and produced by systems, organizations, politics, technologies, financial mechanisms, political economy. There's all these things that shape data. And as a result, everything that is in society gets baked in the algorithms and in the data that we use. So I think increasingly we need to be thinking about this idea of data assemblages and aiming to achieve equity and inclusion and participation in these supporting assemblages so that we can then have those translated into the models, the data, and the algorithms that we're developing. And I think the idea that sometimes we put too much focus on the artifacts, on the resultant artifacts, without interrogating the processes and the mechanisms and the institutions that produce those artifacts. So I think part of the question that I would really pose to Franz and Nicole is, what, in your experience, what does transformative use of AI and big data for gender equity, what does that look like? Are there any good examples that you can share where actually we can see how these approaches challenged the underlying, let's say, power structures? They have empowered the marginalized to participate a bit more meaningfully. I'd love to hear a bit more about some of those examples in your experience. And I think lastly, excellent presentation as well from Jonathan, highlighting once again some of these potential benefits of data, big data approaches. And I think what was key for me in his presentation is the fact that some of the problems that he was highlighting. So for example, the fact that you still have community health workers who work long hours, who are overworked with no pay. These are all issues that ultimately are societal issues. I mean, these are structural issues that technology in and of itself cannot solve. And I think it's difficult to anticipate, how does technology start to address and contribute to fixing some of these structural issues which are existing in societies, and which, by the way, are part of what perpetuates marginalization and inequity in different societies. So those are just my quick reflections. And I think, once again, maybe just the conclusion, if we come back to the quick question of the seminar, how does AI and big data advance gender equity? I actually took a bit of an extreme position to say that actually they don't. I think it's the institutions, it's the human intent that gets amplified by technology that enables us to achieve some of these goals. And I think increasingly we need to be thinking a lot more about how do we transform, of course, as we said already, how do you make sure that there's better participation of women in data science and AI? How do you make sure that our institutions are more inclusive? And until then, that's when we can actually start to anticipate achieving gender equity. So that's my quick reflections and some initial questions to prompt discussion. I'd be happy to hear some thoughts on that.
Claudia, I think you're trying to unmute yourself, but while Claudia is finding the unmute button, I just wonder, since we haven't yet heard from Jonathan, I wonder if you could take an immediate stab at responding to some of the comments Mamelo kindly posed, and then we'll sort of go back to front and hopefully then close us out.
Yeah, Mamelo, those are very cogent points, and I wholeheartedly agree with all of them. I think one of the things we joke about in our sales process at Tamagi is if you have a poorly run CHW program, we'll give you an even more poorly run CHW program when you add CommCare. So technology is really an amplifier of systems. If those systems are inequitably designed, amplifying them is going to give you even more inequity. One of the things that I wanted to touch on was this point brought up around how you take traditional systems, what we would kind of label administrative data, counts of pregnancies, counts of visits and things, and these qualitative data sets. This is an area where big data and AI can have a transformative impact, not because it's going to have these big insights on what we should do next, but because it can bring in externalities of the positive benefits of taking better care of marginalized communities, whether that's gender-based or other. We look at things like climate change and the inability to craft a financial ROI argument. We're now seeing the impacts of just, health and air pollution. That alone, when you multiply it out far enough into the future, drives the government's ROI on improving air quality, irrespective of whether you buy into the logical framework of how the science works. I believe big data and AI can have a transformative effect. What is the value of better detecting febrile illness in a rural population in a community that is Ebola instead of malaria? Or what is the benefit of making sure early childhood development does not have malnourished children, because for the next 40 years, they're going to be a higher tax revenue base? That type of insight that can only be done with increasingly large, diverse data sets to pack in all these positive externalities. And that's one of the areas I'm most excited by, not because we're going to come up with some AI model that tells the CHW which household to go to next, but because we're going to be able to combine these data sets in a way that can show how much more value we should be pricing in to serving the poor.
Okay, thank you very much, Jonathan and Mamelo and Neha for this discussion. There are some questions in the Q&A that were already answered, so I think we can close now. I just want to thank all the panelists and all the attendees for another excellent session. Just join us in our next webinar at the end of August. And if you want to sign up to be part of the Gender and Health Hub and be in our mailing list, please go to our website and follow us on Twitter and on the LinkedIn. So thank you very much all. And it was another excellent session. So we could stay here for another half an hour, but sadly, we need to finish now. Thank you very much.
Thank you, everybody.
Thank you, everyone.
Thank you to the UNUI.
Thank you, everybody. Yes, thank you.